Do you have sciatica pain? If you do, one of the main causes is a lumbar disc herniation. Keep watching this video to learn more. First things first, sciatica is not a diagnosis. A lot of people out there are diagnosed with sciatica, but sciatica comes from a lot of different causes. So if you just say it's sciatica, you don't actually know what's triggering your pain. And that's a big problem because one cause of sciatica is totally different from another, which means it's going to be managed totally differently in terms of exercises and therapies that you want to do in order to reduce your symptoms. Sciatica really just refers to pain coming down the back of your bum, down the back of the thigh, and even down into the lower leg and the foot. But it doesn't really clarify where the sciatica pain is coming from. Sciatica can be caused by a few different causes. Some of the conditions are piriformis syndrome. You get peripheral nerve entrapment of the sciatica at any of the muscles that flow around it, so at the hamstrings, at the calves, etc. You can also have pseudosciatica, which are structures that produce sciatica-like pain. This can be caused by the capsular tissues of your sacroiliac joint. It could be caused by the joint itself. It could be caused by the ligamentous tissues around the sacroiliac joint. Heck, even referral pain from your glutes can mimic sciatica pain. This is why it's really important that you ask your clinician, your doctor, your physio, what is actually causing your sciatica pain, because exercises for one cause is going to be completely different for the exercises of another cause. All right, let's move forward to what we're actually here to talk about, which is a lumbar disc herniation. A lumbar disc herniation is also known as lumbar radiculopathy, and basically it occurs when the nerve root of your lumbar spine is being compressed by the lumbar disc. Basically, you have 5 lumbar vertebrae, well, most people. Some people have an extra one, but we're not here to talk about that today. And you see these gelatinous structures in this model, these are your lumbar discs. Now, it's made out of 2 materials, a harder outer material and a jelly-like inner material called your nucleus pulposus. Now, I know it said these look like jelly structures, but they're actually, in real life, your discs are much stronger than any type of jelly. They actually can handle a lot of load, and that's actually their main function. A lumbar disc herniation happens when the outer disc gets worn down over time through a variety of different reasons, including just simple aging, mechanical overuse, the list goes on. It could be caused by any number of things. What happens is slowly the nucleus pulposus, which is found at the center of this disc, slowly migrates backwards. And this particularly happens when you're flexing forwards. That nucleus pulposus, due to the pressure applied to that disc, migrates posteriorly or backwards. Now, what ends up happening is that if you see these yellow structures right here, these are your nerve roots. What ends up happening is that nucleus pulposus can then apply pressure to your nerve root, which will make your pain appear down the rest of the leg. Now, why does this pain appear? It's because your sciatic nerve comes from your lumbar spine. And it's actually composed of a number of these nerve roots that's found in lumbar spine, which means your lumbar disc herniation can apply at any of these levels and still produce that sciatica pain. The most common sites of your lumbar disc herniation is at your L4, L5 disc or your L5, S1 disc. So let's rewind a little bit. One thing I said was that flexing forward of that lumbar spine can apply an increased pressure of your nerve root, leading to your sciatica pain. Now, that is not to say that lumbar flexion is a bad movement to do. It's just very sensitive for you to do right now if you have an active lumbar disc herniation, which also means eventually we want to get you back to moving into that flexion position during your late stages of your rehab so that we can fully restore function back into your spine. You can't avoid this movement forever, and that's the #1 mistake that a lot of people do. Likewise, this means that if we could put you into a position that alleviates this pressure, namely lumbar extension, this can actually help you with your recovery process. But there are certain circumstances where lumbar extension might feel worse for you, and it really does depend on the location of your disc herniation. So you should ask your physiotherapist or your chiropractor or your medical doctor which type of disc herniation you have and which movements are safe for you. Now, generally speaking, most lumbar disc herniations will feel sensitive during lumbar flexion, and that usually produce a pain that is found in your sciatic nerve. Now, before we get into any of the exercises that we're going to do in this video, there are a few things that you have to take into consideration. These exercises are going to be done daily, perhaps multiple times per day. And generally speaking, this is because you want to reduce the amount of pressure applied to your disc and therefore your nerve root as much as possible so that you could reduce the amount of pain experienced in your sciatic nerve. With any new exercise that you might be doing, it's really important that you do not push yourself into pain. You can make your condition feel worse, and if that's the case, you're not going to be happy about that. If you feel that any of these movements make your sciatica pain feel worse, please consult your healthcare professional, including your chiropractor, your physiotherapist, or your medical doctor about which first steps you should be taking instead, because you do not want to be aggravating your condition. Another thing you need to think about is that if you see your symptoms progressing rapidly, you should definitely go get checked by a medical doctor. This means if you see a remarkable loss of strength, loss of sensation, loss of basic function, including bowel or bladder movements, you should probably see your doctor right away. Additionally, generally speaking, a lumbar disc herniation can take anywhere up to 8 to 12 months for you to fully resolve your symptoms. And that is with you doing your physiotherapy exercises. Without doing your exercises, it can take 2 to 4 years for the symptoms to go away. So it's really a good idea for you to get started with your exercises. And like I said, it's best to work one-on-one with a clinician near you. Lastly, as I mentioned before, you definitely do not want to self-diagnose yourself with a lumbar disc herniation. You want to get checked by a professional because it's going to make a huge difference in your care. The first few exercises that we'll be doing are going to be nerve flossing exercises. And the purpose of these exercises is actually to increase the mobility of your nerves. We're not trying to stretch your nerves, we're just going to try to move them back and forth, and this will decrease the amount of pain that they're experiencing. All right, so let's get started. All right, so the first exercise we'll be doing is the sciatic nerve flossing exercise. And we'll be doing this in a face-up position. But before we get started, imagine this. Now imagine this yellow band is your nerve. A flossing exercise is about taking this nerve and moving it back and forth throughout the body. What this does is it mobilizes your nerve between all the different types of soft tissues that it travels through in your body. What we don't want to be doing is take that sciatic nerve that's already sensitive and stretching it out from both ends. So it's going to be really important that during this exercise, you're moving 2 different parts of your body at the same time, namely your head and your leg. So we'll take a look at that right now. Now, the first thing you're going to do is find something like a bench or a bed that you can do this exercise on. You can do this exercise on the floor, but the floor makes it a little bit more difficult for you to move your head as necessary during this exercise. So I'm actually going to be lying down on this bench with my head just slightly off of the edge of the bench. I'm going to be lying down face up on my back here. And as you're going to note, my head just lies off the edge of this bench. From here, I'm going to simultaneously look up with my head as I raise my head up. And this is because this is going to floss my nerve down towards my leg during this exercise. And as I lower my leg, I'm going to look up with my head, pulling that nerve upwards towards my head. And so we're just going to repeat this exercise back and forth. You can kind of visualize that my nerve is just going this way and my nerve is going this way. Now, if you do the exact opposite, which is stretch the nerve, what that'll look like is bring your head towards your leg at the same time. And trust me, you're not gonna like that. It's gonna feel pretty terrible. Even lying down like this, if you want to alleviate some pressure, you could just look up and that'll decrease the amount of pressure that your sciatic nerve is going to be experiencing. But it's best to kind of do this with movement. Now, there's a few things that you need to think about. If you've been recently diagnosed with a lumbar disc herniation, chances are you're not going to be able to do the full range of motion during this exercise. Your sciatic nerve is just going to be super, super sensitive. Not to say that it's necessarily damaged, it's just not really happy with you right now. So it's totally okay to kind of do half repetitions, quarter repetitions, just doing whatever you can actually handle without aggravating your symptoms. Now, even if shortening the range of motions is still a little too sensitive, you can actually complete the exact same exercise, but keep your knee bent. And the more you bend your knee, technically, the less pain you'll actually feel. So it'll kind of look the exact same, except for your knee is going to be bent. So in essence, this exercise should be completely pain-free. I actually don't want you to feel any type of stretching sensation during this exercise because that would indicate that you might be putting a lot of tension through that sciatic nerve. Now down the line, when your sciatic nerve is not as sensitive, yes, we want to practice stretching out that sciatic nerve, but right now, it's probably going to hurt too much. So we're going to lay off of that a little bit and let's just get it moving back and forth. And this will help to reduce the amount of pain that you're feeling, at least in the short term. All right, and then we're going to do the next exercise progression now, which is actually the sciatic nerve flossing, but from a seated position. All right, so the next exercise that we'll be doing is a progressive exercise, basically building off the same concepts of the last one that we just did. It's a seated sciatic nerve flossing exercise. So the purpose of this exercise is just to help that nerve guide up and down throughout your body, and instead of tensioning up like that. Again, we'll work on that next time in another video, but for now, we just want that nerve to floss. The only difference with this exercise is that now we're going to add a few extra moving parts. Namely, we're going to be moving the knee instead of the hip, and we're going to also be introducing some ankle movement as well. And you'll be simultaneously moving the head, knee, and ankle all at the same time. So we have 3 moving parts now instead of just 2. For this exercise, you're going to simultaneously look up, just like the exercise, as you extend the knee and point your toes towards your face, okay? So that is ankle dorsiflexion. So what it looks like all together is looking up, knee straight, toes up. From there, you're going to do the exact opposite, which is look down, knee bent, toes down. And you're just going to do this exercise up to 20 times if you can tolerate, pain-free. Once again, just like the other exercise that we did, if there's a range of motion that's a little too sensitive, just cut the exercise short by 5 to 10 degrees, as I want you to do this exercise completely pain-free. Now, a little bit of discomfort is okay, so long as it's not that nerve tension sensation. Another thing that you can do is just use your hands to support your back by leaning back a little bit, and you can complete the same exact movement. This is just a regression of the regular version that you can do as you're working your way to doing the full form. Generally speaking, nerve flossing exercises are done about 2 to 3 times during the day. You'll be doing about 1 set each time, and you can do anywhere between 20 to 30 repetitions. It really does depend on how sensitive you are to the movement. If you're very sensitive, it's completely okay to just do a few repetitions and work your way up as your nerve mobilizes. If you find that your symptoms actually worsen with this exercise, please stop right away and consult your healthcare practitioner, as you might have something else going on with your nerve pain. All right, so we're going to move on to our last exercise that actually has nothing to do with nerve flossing at this point. Instead, it's about moving your back into lumbar extension, as this is generally the more comfortable position if you have a lumbar disc herniation. Once again, if you actually find that lumbar extension makes your sciatic nerve pain a little bit worse, please consult your physio or chiro or medical doctor right away. This last exercise is called the elbow cobra, and you can actually do this exercise to help you to progress to a full cobra. And all you're really doing is you're using your elbows to prop your body up so that you can push yourself into lumbar extension, therefore decreasing the amount of pressure on your lumbar discs, therefore decreasing the amount of pressure on your nerve roots, therefore decreasing the amount of pain in your sciatic nerve. So all you gotta do is lie down on the floor or your bed, and you're going to go belly down. So you're going to just go into a position where you can prop yourself onto your elbows. And as you can see, my lumbar spine is going to be naturally in this position into extension. And this tends to be a relieving position for most people with a lumbar disc herniation. But if it's not relieving for you, don't do it and go see someone to get a consult. If you're very sensitive to this position, you're only going to hold this position for up to like 30 seconds or so, and you're only going to go as high as you can tolerate. So in the beginning stages, if you can only prop yourself up a little bit, just like that, and that helps to reduce the pain, that's a great thing that you can start with that. Otherwise, you're going to go right up onto your elbows. Now, for people who could actually stay in this position for a decent amount of time, I usually tell them the more the merrier. So you can do this throughout the day. You could go on your phone, or you could go on your tablet, or you could do any type of work or read a book or whatever it is that you usually do. You just kind of stay in this position so long as you need, so long as it doesn't make your back less comfortable, or as long as it doesn't increase the amount of sciatic nerve pain that you have. Now, progressing forwards, to actually do the full cobra, you're just going to place your hands where your elbows are, and you're just going to slowly extend your elbows to kind of push yourself into a full lumbar extension position. And you're going to hold this position for up to 30 seconds before you just slowly lower yourself down. You're going to rest for another 30 seconds or so, and then you're going to go for another repetition. And you'll be doing anywhere between 5 to 10 repetitions of this, and you can do this spread out throughout the day. Now, if those exercises start to become too easy and you want to do something a little bit more functional, you can actually do a standing version of this exercise, and we'll do that next. Now, before we get to this next exercise, there is actually a benefit for doing the elbow version of the cobra versus the full cobra. And that is basically you can stay in that elbow cobra for a longer period of time before you get tired, compared to the full cobra, whereas you might get tired in that after about 5 minutes of doing that exercise. So it's really great to do both if you're able to, because the elbow cobra will allow you to sustain that extension for a longer period of time, which can be very beneficial, whereas the full cobra will have a higher intensity and it can make a greater impact in terms of the amount of extension that you can introduce to the spine. So doing both is going to be great. Doing the elbow all the time is going to be the best option if you can't do the full extension. Now, we're going to work on that extension movement by using something like a wall to help you do it in a standing position. Except for, I don't have a wall here, I have a squat rack, but imagine this bar is just a wall instead. So you're going to be putting yourself, as you can imagine, into the same elbow cobra position, except for you're going to prop yourself with that wall. What that means is I'm going to place my elbows against this bar, but imagine it's a wall, and you're just going to lean your hips forwards to get extension going through your hips. And you'll stay like this for up to 30 seconds before returning back to a neutral spine, and you'll rest for about 30 seconds before you repeat again. Now, if you have a wall, you could do the same thing with your hands, and you just push yourself into extension just so that you can kind of get a little bit more depth with that extension. Eventually, you can move away from doing the wall and just do it with your own body weight. All you do is you place your own hands on your own hips, and you just place those hips forwards to get some lumbar extension into your spine. Hold that for 30 seconds, and and then come back off. Now, as you can imagine, you have way less support while you're doing that full version of the exercise. So start with the wall, see how it feels, progress to the unsupported version afterwards once you can tolerate it. All right, so that wraps up our video on lumbar disc herniations and the exercises that you can do to get started. Now, these exercises are considered very basic exercises that you'll do in the first few weeks to first few months of your rehab program. But you'd really want to progress your exercises so that they become a lot more functional, and that will allow you to reintroduce regular movements back into your day of life. So please consult your physiotherapist, chiropractor, or other medical professional for you to get the right care that you need. If you're looking for some more help in person, we do have 2 locations in the GTA. We're located both in Markham and North York, so please give us a visit if you need some one-on-one care. If you'd like to see more advanced exercises, please let me know in the comments below, and I'll think about making a part 2 to this video. If this is your first time watching a video on my channel, please hit subscribe. Otherwise, I'll see you next time. Peace.